Hello and welcome. Exploring the negative effects of visceral fat. When most people think about weight loss and fitness, they focus on burning fat and building muscle. However, there is an often overlooked type of body fat that can be even more dangerous than the visible subcutaneous fat, visceral fat. This type of fat is found deep in the abdominal cavity, surrounding vital organs such as the liver, pancreas, and intestines. In this video, we'll explore the negative effects of visceral fat on your health, including its links to type 2 diabetes, heart disease, and other health problems. We'll also provide you with some tips on how to reduce visceral fat and improve your overall health. What visceral fat is and why it's dangerous. Visceral fat is the type of fat that is stored deep within the abdominal cavity and surrounds vital organs such as the liver, pancreas, and intestines. Unlike subcutaneous fat that is stored just beneath the skin, visceral fat cannot be seen or easily measured. While some amount of visceral fat is necessary for cushioning and insulation, too much of it can be harmful and lead to serious health problems. Visceral fat is metabolically active and produces hormones and inflammatory chemicals that can interfere with the body's normal functioning. This can increase the risk of developing chronic diseases such as type 2 diabetes, heart disease, stroke, and even some types of cancer. 2. Understanding the difference between visceral fat and subcutaneous fat. Subcutaneous fat is the fat we can see and feel right under our skin. It's the pinchable fat that's often found on our thighs, hips, and belly. While it may not be aesthetically pleasing for some people, it's considered a benign type of fat. It serves as an energy reserve and insulation for our bodies. On the other hand, visceral fat is a much more dangerous type of fat. It's the fat that's stored deep within our abdominal cavity, wrapping around our internal organs such as the liver, pancreas, and intestines. Unlike subcutaneous fat, visceral fat is metabolically active and produces hormones and inflammatory markers that can increase the risk of various health issues like heart disease, type 2 diabetes, and even cancer. It's important to note that not everyone who has belly fat has visceral fat. However, visceral fat is strongly associated with excess belly fat. To determine whether you have visceral fat, you'll need to undergo imaging tests such as CT scans or MRI. Health risks associated with high levels of visceral fat. What's concerning about visceral fat is that it's highly active and can produce harmful hormones and chemicals that can trigger inflammation in the body. High levels of visceral fat have been linked to a range of health problems such as insulin resistance, type 2 diabetes, heart disease, and even certain cancers. Studies have shown that even in individuals who have a healthy weight and BMI, high levels of visceral fat can pose a significant risk to their health. This is because visceral fat is linked to the production of cytokines, which are proteins that cause inflammation in the body. There are several ways to measure visceral fat, including imaging tests like CT scans and MRIs. The most practical and widely used method is measuring waist circumference. To measure your waist circumference, take a measuring tape and wrap it around your waist at the level of your belly button. Ensure the tape is snug but not too tight and do not hold your breath while measuring. A waist circumference of over 40 inches in men and 35 inches in women is considered high and may indicate a high level of visceral fat. Another way to measure visceral fat levels is through bioelectrical impedance analysis, BIA, or dual energy X-ray absorptiometry, DXA. What causes visceral fat to accumulate? Visceral fat is a type of body fat that accumulates around the abdominal area, surrounding the organs in the abdominal cavity such as the liver, pancreas, and intestines. The accumulation of visceral fat is caused by several factors, including genetics, diet, and lifestyle. One of the primary reasons for the accumulation of visceral fat is a diet that is high in calories, saturated fats, and processed foods. These foods are typically high in sugar and carbohydrates, which can cause fluctuations in blood sugar levels and lead to the accumulation of fat. Tips for reducing visceral fat through diet and exercise. Reducing visceral fat can be achieved through a combination of diet and exercise. By making simple lifestyle changes, you can help to reduce your risk of developing chronic diseases. Firstly, it's important to focus on your diet. Cutting out sugary drinks and processed foods and replacing them with whole, nutrient-dense foods can help to reduce visceral fat. A diet rich in fiber, lean protein, and healthy fats has been shown to be effective in reducing visceral fat. In addition to dietary changes, exercise is also crucial. High-intensity interval training, HIIT, has been shown to be particularly effective in reducing visceral fat. This involves short bursts of intense exercise followed by periods of rest. Weight training and aerobic exercise are also beneficial in reducing visceral fat. Other lifestyle changes that can help to reduce visceral fat include getting enough sleep, reducing stress, and avoiding smoking and excessive alcohol consumption. By implementing these changes into your lifestyle, you can reduce your visceral fat levels and improve your overall health and well-being. Visceral fat is a silent danger that can lead to some of the most serious health problems if left untreated. Now that you know how to identify and measure visceral fat, you can take proactive steps to reduce it and improve your health. Remember, small lifestyle changes such as a healthier diet and regular exercise can make a significant difference over time. Thanks for watching. Kindly comment, like and subscribe and turn your notifications on.